What is up, medical wig providers? I just wanted to pop in. I just got off, did like 5 or 6 12-hour shifts in a row. I am exhausted, but I did do a call today, and one of the questions that I got was, will Care Credit cover the cost of wigs? Because so many people are advertising that they can accept Care Credit for wigs. So it is a yes and no answer. If you are accredited, and that is a process that licensed cosmetologists and licensed barbers or even trichologists can go through, where a third-party entity comes through and they basically do a survey of your processes, a survey of how you collect and maintain documentation for your clients, and then they deem you as compliant with what CMS or Centers for Medicaid and Medicare, it deems you compliant with their processes. If you can pass that audit, then you can be granted what's called accreditation. The only way that you can accept Care Credit for wigs legitimately is if you are an accredited DME provider. What is DME? Well, if you were on the live last week, we talked about DME being a durable medical equipment. That is the classification of medical wigs or cranial prosthesis as it relates to insurance. So if you check all of those boxes and you are accredited as a DME provider, then yes, you can accept Care Credit. If you are not, Care Credit unfortunately will not be an option for you to accept directly for billing. However, don't be discouraged. There are other financing options available. And I'm mentioning this because you may have clients that don't have the benefit in their insurance, or they don't have insurance at all. So you want to have other mechanisms in place outside of just saying my wig is $3,500, take it or leave it. You know, keep in mind some of these individuals, especially the ones going through dealing with rather active diagnosis of, you know, cancer, and they maybe going through chemo or radiation. Financially, they may not be able to afford to give you $3,500 for a wig, especially if they're not able to work, if they don't qualify for disability and they're not sitting on a trust fund. So you want to be cognizant of that and offer other options for financing. So things that you may want to look into would be Sezzle, Affirm, those finance companies like that kind of work with all credit types, but those are alternatives. So instead of when a client calls you and says, hey, I've got Care Credit, you can let them know that you're not in a capacity to accept it, but offer them an alternative, Sezzle or Affirm or any of those. I think it's so many of them out there, but those are the ones that I most recently worked with. But just my 2 cents on that. We will be back next Tuesday with a live demonstrating how to properly conduct a consultation, and then also how to not conduct a consultation. So this will be good. Y'all excuse my head, I had to tie it up today. I work step down, and so it be real up there sometimes. But yeah, I hope everybody had a good day, whatever day of the week this is. I hope you had a good day. And got questions, drop them in the comments. I will get to them probably tomorrow. But that's just my little piece on being able to accept Care Credit for medical wigs. Y'all have a good night.